With clear skies, tall buildings, sea lions, and tons of attractions, San Francisco is one of America's most beloved cities, but they've also got a few problems to solve.
San Francisco has more homeless than anywhere else in the Bay Area. The number of people on the streets in the city is nearly twice the number of San Jose and 3 times the number in Oakland.
It's a hard knock life for us. It's a hard knock life for us. Static treated, we get tricked. Static kisses, we get kicked. It's a hard knock life.
So what's your name?
My name's Kyle. I mean, right now I'm looking for work. I'm 23. I was born and raised in San Francisco. I went to an arts high school, and I was homeless for 3 years, 4 years, something like that.
Should you briefly tell us how you ended here in the past?
And the whole reason why I wasn't working after I left my house and left my family was because I had broken my wrist. I fell off a train and wasn't able to work. I got lucky with somebody that was willing to let me stay at their place for a while. It cost a lot.
It cost a lot.
I think a lot more in damages that aren't necessarily through the hospital, in just living expenses and the inability to work and the inability to get real disability or any kind of unemployment assistance.
Healthcare bankrupts so many people in the United States, right? I mean, if you don't lose all your money to housing, you're going to lose it to a medical bill. So my name is James Lynn, and I am the director of the Center for Social Justice at Glide. The organization as a whole functions primarily as a human services organization for people who are very poor, people who are homeless, and we are based here in San Francisco, working largely with people who are either in this neighborhood, the Tenderloin, or in the adjoining neighborhoods, who come to the central city of San Francisco for assistance.
Glide is a place where people come to eat. The homeless, they even get to stay, providing services that are needed by the coloreds and the whites also. Most of the people here are in need.
There's a few programs and churches and stuff that come around and will give out clothes and food and other kinds of things that help. But it's hard. I've tried to take use of just about any program that's out there. And for a lot of them, I didn't qualify for whatever demographic they're looking for to work with. As a young person, at least, it's difficult to find services that you can actually utilize.
How do you get qualified?
You get AIDS or something, or a variety of other lifetime diseases.
The meals program, which is the largest program, is entirely open. It doesn't matter who you are. The childcare program, on the other hand, because it's funded by government sources that keep track of these things, requires that we do income verification. So in that case, we actually have to see a pay stub or something similar in order to know that you are, or your family is low income. So there's some programs that have some restrictions.
If you're part of a family, there are even fewer resources because most of the resources here are for single men and women, those who are abused and have mental health issues, those that are abusing drugs. If you don't fall under any of those categories, you're pretty much left to your own devices to scatter in the wind. I myself, college degree, no record, there's no reason that I should be standing on a street corner holding a sign asking people for money. There's no excuse for it. This is gentrification at its finest. And my children, they're being casualties because of it. And these ramifications are not irreversible. They spread throughout families, and they spread throughout generations, and they spread throughout communities. And it's like, it's not an epidemic anymore. This is a pandemic. This is not something that's isolated just to San Francisco. This is isolated to one of the richest countries, the United States of America, where we're living in third world conditions. We have states in this country who have been without clean water since 2014, but yet people can tell you everything about the Kardashians. Here I stand with a college degree asking for people, help me pay for my daughter's seizure medication. Because I can't do it myself. Because gentrification has X'd out the middle class and the working class. If you're not rich, you're nothing.
So the woman's story, regardless of the details of it, in general represents something that is happening here in the United States, which is people are being catapulted into poverty by medical bills. And you probably know that our current Congress and the president are attempting to actually undo a lot of the medical coverage that was instituted. So we're in transition again.
Obamacare is a complete and total disaster. They can say what they want. They can guide you any way they want to guide you. In some cases, they guide you incorrectly. In most cases, you realize what's happened. It's imploding as we sit.
It's gotten very complicated. There was a transition with what we call Obamacare, or the Affordable Care Act, a few years ago, which changed the eligibility for a lot of people who are low income. And so I think during that transition, a lot of people might have slipped through the cracks. So in those cases, like I said, we could do a one-time grant, but our goal would be to actually help you get back into the system that is designed to subsidize your health care.
Did the government do anything for you that would help out?
Not really.
Not really.
I mean, there's a food stamp assistance program where you get a couple $100s worth of food, food money, but you can only spend it on certain things and in certain places, and it's really not much help.
How do you sign up for that?
You have to go to the welfare office.
My name is Josh. I'm a mobile services coordinator for Lava May. So I drive the truck, maintain the truck, clean the showers, make the list for our shower guests. Basically just make sure it operates. We help San Francisco's homeless. So we travel around the city 7 days a week. We have 9 services, so we have 2 trailers, different locations every day. No questions asked, no information given, no names taken. You don't need to tell us anything to get a shower. You can walk up, get on the list, and get a shower without even giving us a name. We do about an average of 40 to 50 guests a day. And then we have 2 services a day on some days. So it's a small part of 8,000 people, but the word is spreading and we're expanding a bit. So we're moving into other cities. We've been in LA since November.
We have an immediate primary obligation to people who are like that woman in trouble with basic needs, right? She's having questions about her food security. So issues around access to food, issues around access to housing, these fundamental, what we would consider a human right, are a focus of ours. And in those areas, are we succeeding? I mean, you can't really succeed in those areas. I mean, the fact is that the country's systems are so messed up. There's not enough capacity to meet everybody's needs. So we stay as open as we can. Our goal would be to actually change the system, right? But in the absence of the ability to undo market capitalism in order to create universal health care or universal housing or universal guaranteed income or something like that, we basically have to just make sure that people don't die and that people have a chance to have a stable place so that they can move on with their lives and do something that they want to do rather than just focus on survival. So in that area, I think we're proud of what we do, but we're not happy that we still have to do it in this country.